This is Shelby Bowen with The Pilgrimage. I am so excited to introduce my guest today, and her name is Rachel, and she is the founder of Wealth of Health and a nutritional therapist. Rachel, thank you for coming on today.
Thank you so much for having me. Excited to be here.
So you have a really interesting journey, and it kind of coincides with mine a little bit. With somebody in your family was diagnosed with an autoimmune condition. Could you share a little bit about how you got into nutritional therapy? I know you used to be an elementary school teacher, and kind of started on this whole long road of doing research and finding out all this information, which led you to where you are now. Could you share a little bit of your journey with us?
Yeah, sure. So, back several years ago, my husband was dealing with some health issues, and we did not know what was going on with him. He has always been very healthy, and it took months and months and months to get an actual diagnosis, which is really common and unfortunate when you're dealing with an autoimmune disease. It happened to be a very ultra rare autoimmune condition. So it was really, there was not a lot of literature on it. I was reading medical
Mm,
journals, I was reading books, I mean, trying to just figure out what was going on with him. And at the same time, my mother was diagnosed with thyroid conditions and
man.
Hashimoto's. So it just happened all within like this window of time. And I just was amazed at the lack of information like readily available for people to figure out what's going on with them. And so
Yeah.
I started listening to podcasts. I started reading tons of books about autoimmunity and how to support it holistically because they
Mhm.
were just throwing drugs at my husband, basically. I was so frustrated with the amount of steroids they were giving him. It was
Wow.
making our relationship crazy because he
I'm sure.
was so uncomfortable and he was like they were kept giving him more and more and more steroids and I was like if you I told the doctor if you give him one more round of steroids I'm going to make you move in with him because I was like I can't take this. So he just it just kept getting worse. There was nothing that was working, and I was worried about the side effects of all of these drugs on him. I have always been very nutrition and health focused like
Mm,
my entire life. So I started doing a little bit deeper research and I
sure.
discovered this program that I wanted to actually be a part of. I found a podcast. So this lady said, hey, I'm a nutritional therapy practitioner. And she would just talk about all these health things and how we can get to the root cause, which has never been anything that any of the doctors we were going to had talked about.
Right.
So I was like, what is this root cause of things? So I emailed her. She has her email address through her podcast and she was so generous with her time and emailed me back and
Mm,
shared with me a little bit about the school she went to because I was like, how do you become this? Like, what do I need to
yeah.
do? Like, I want to be you. Like, I was like, I want to be you because I want to be able to help. Like, if nothing else, I want to be able to help my mom and I want to be able to help my husband.
Wow.
So that's kind of the route I took to get into
Mhm.
this like more holistic uh, field of health and well-being.
Mm. So, really it's when these things hit so close to home. And I know for me, I was diagnosed with Epstein-Barr, which they also say, you can't cure. It's just something you'll have for life. There's things that you can do to help. And I am no expert, but I've found that for me, like focusing on my gut health and, you know, from what I've kind of the little bit of research that I've done is like a lot of these diseases are formed in the gut or like, are contributed to gut health. Can you share a little bit with everybody who's listening? Maybe they don't have an autoimmune condition, but they, have low energy and just aren't, they wake up and they feel like they're not able to perform at the level they want to. What are like some tips and tricks you've learned, like when you were just getting started with helping your mom and helping your husband that showed you there was a light at the end of the tunnel?
Yeah, so definitely gut health is so important. There Without our gut health, like we lose our health, right?
Wow.
So much of our immune system lives inside of our gut. So
Mm,
it's hugely impactful for things like autoimmune disease or chronic illness because when we lose those tight junctions within our gut, we start to have problems, and then we
yeah.
start to have like one autoimmune disease, then we have two, and then we have three, and so sometimes they can build off one another if we don't get to the root cause and really help to
Mm,
nourish and seal our gut to ensure that we're absorbing our nutrients really well and making sure that our digestion is working properly. So all of
yeah.
those things, that's like one root cause for
Right.
autoimmune disease. But the great news is it's never too late to work on your gut health.
Mm,
So that's like the light at the end of the tunnel,
yeah.
that it's never too late. Even if you've had an autoimmune disease for 20 years, it's not too
Mm,
late to go in there and let's work on support that digestive system. Let's support that gut health and get it nourished so it can do its job and help our immune system instead of making our immune system attack our bodies. So it's just know that it's never too late to do that. And
mm,
you can always work on that at any point in your life and get
mhm.
that fixed up for sure.
So, how is your husband's health doing today now that you became a nutritional therapist and you have clients and people that you help? I think that everyone wants to know, like, how has what you've learned help, the people that you originally set out to, help overcome their problems?
Yeah, absolutely. So my husband is doing great. He
Mm.
was on a medication, an immune suppressant. We have been able to get him off of that
Wow.
immune suppressant altogether. So he is perfectly healthy and back to like his normal self. And I would say that's thanks to working on his gut health and
Mm,
the foundations of health in general. That's really supported him on his wellness journey. And as for my mother, she is doing really, really well. She was having a lot of chronic fatigue.
yeah.
She would be, sleeping 8 hours and waking up. And she's like, I literally just need to go take a nap after about an hour of being awake. So she no longer has any of that. She's got
Wow.
tons of energy. I think more energy now than I even remember her having as I was a child. Uh,
Wow.
it's fantastic. So
Amazing. Mhm.
I love to see that. So she's also doing very, very well,
Yeah.
and her thyroid is doing its job. So she's even been able to lose a little bit of weight, which was something that she battled with
Mm,
for
mhm.
as long as I can remember.
Yeah.
So yeah, so all around great. She's got her energy back. She's been able to lose a few extra pounds, which in turn helps with,
Mhm.
inflammation is lower, so joint pain is less. So she's just thriving.
What would you say, are some key things that people should eliminate in their diet or in their environment that, would be prohibiting them from healing?
Yeah, so for most of us, we do have a gluten sensitivity. So
Mm,
one of the things, and I don't recommend this for everyone because everyone's not on board. We're so bio individual, and
yeah.
I want to honor that because that's part of my
Mhm.
job is to honor that like we're all different. So what works for you won't work for me. And
Mhm.
I think we lose sight of that. especially as we're
Mm.
scrolling social media and we see like, oh my gosh, she cleared her skin by doing these 5 things. Well,
Right.
yeah, that worked for her, but guess what? You're not her. So that may
Mhm.
not be the case for you. So as far as diet goes, I do like to lower gluten because it's an
Mm.
inflammatory. It raises your inflammatory markers. And especially for people with autoimmune conditions, there's a
Mhm.
high correlation between gluten sensitivity. And that doesn't have to be like
Wow.
full blown celiac, right? This is
Right.
just a sensitivity and having an autoimmune disease. So,
Mm.
gluten is one of the things I really like to wean or crowd out
Yeah.
of my clients' diets. And not saying that, you know, all grains are bad or anything like that. It's just being a little more aware of what creates some symptoms for you and some discomforts for
Mhm.
you. So that dairy is another really big one that is
Mm.
can cause issues. And it's
Mhm.
not all dairy, right? Like it's typically like cow's milk is a big one. Some
Mhm.
people tolerate different levels of lactose, and so just being aware of
True.
what the levels are in different
Mhm.
cheeses or different dairy products. So those two things
Yeah.
are really helpful when you're dealing with an autoimmune condition or a chronic disease even. And of course there's sugar. That's a huge one. We all know, and I'm not saying like we need sugar, but we need not the white processed sugar, right? We need
Right.
natural sugars. We do need to have some of that in our diet. But I
Yeah.
want people to keep in mind that that's more like honey, maple syrup, maybe agave,
Mhm.
um, instead of like spooning in, tablespoons of sugar into our coffee, basically.
Oh, yeah.
You know, trying to make that switch. So again, that's just an inflammatory, which is only going to contribute to gut
Mm.
issues and dysbiosis.
Yeah, I know a lot of people talk about, and I wanted to get your take on like the seed oils. Anytime me and my husband go to the grocery store, it's so funny because he's learned to be patient with me because every label I'm looking over it and I'm like, okay, it has canola oil in it or it has like sunflower oil. So I'm like always trying to like buy things that, aren't like have all of these seed oils in it. What would you say as far as that goes?
Yes, I love that you brought that up because that is a huge one. I am very I'm the same way. If I'm buying something packaged, I am sitting there and reading the label because I want to make sure there's no vegetable oil, canola oil, sunflower seed,
Mhm.
safflower seed, um, you know, oh my gosh, cottonseed oil.
Mm.
There's just
So
all
many.
these different like inflammatory, highly processed oils. And
Mhm.
that's also going to contribute to your gut issues.
Yeah.
It could make you bloated, which is just generally uncomfortable. So, yes,
Right.
being very careful, especially like if you're buying nuts and you like to eat nuts and you tolerate
Mm.
them, nuts are great, right? They're full of like nutritious, omegas
Mm.
and all these great things for us. But I always am like, buy dry roasted nuts. They can be dry
Mm.
roasted and salted. Like, it's okay. Like, salt is not our
Yeah.
enemy. Of course, I'd rather have sea salt,
Mhm.
but it's when you look at the roasted nuts, they're roasted in like peanut oil or vegetable oil or canola oil. And so, just even if it says on the
Uh-huh.
outside of
Yeah.
the bag of almonds you're looking at, olive oil and herb roasted almonds, turn
Mhm.
that bag around and look at
Yeah.
that label because you will be really surprised and shocked to read that one of
Mhm.
the first ingredients in that package is probably going to be like vegetable oil or canola oil. And the very last ingredient, which is like the smallest percentage of what's in the product at the end of the ingredient label, it
Mhm.
will probably say olive oil,
Right.
but it's the
Yeah.
last
It's like
ingredient.
always.
So it's shocking. So yes, I am big on
Yeah.
reducing all of those inflammatory oils for sure.
Yeah, I have found that has really helped. And even what you were saying about gluten is so interesting because I hadn't heard that, but often if I eat gluten, my stomach will hurt a lot. I'll feel kind of bloated and heavy. And so, yeah, that's really interesting. I'll have to try to cut some more gluten out of my diet. So, in our culture, in our society today, mental health is a big thing. And, you know, while I would never tell anybody what to do, I think that oftentimes maybe like the medical establishment would, like take more of the prescription route into helping people with mental health, which, I'm not like knocking that at all. But, there's this side of how nutrition can help your mental health and, whether you have a, chronic condition. I know for me, dealing with that affects your mental health, or, you just turn on the news for 5 minutes and your mental health might not be doing too good either. So, what would you say as far as like what you've learned along the way, as far as how nutrition can help those who are suffering with mental health issues?
Yeah, so just keep in mind that like when we're eating a healthy diet, this really impacts like our mood. It can help us reduce stress, can boost our energy levels based on like what we're eating. Um, and it can protect us from like mental health conditions. So I
Mm,
want you to think about depression, anxiety, dementia. So like nutrients are essential. Like it is not optional. These are essential for our brain function. So
yeah.
60% of our brain is fat. So there's
Wow.
so many vitamins that are fat soluble. So A, D, E, and K, and omega-3 fatty acids. Those are all fat soluble vitamins. So these have been
Mhm.
all really proven to be supportive for your mental health. So we all know like vitamin D, right? We get vitamin D from the
Yeah.
sun. Um, but it's
Mhm.
fat soluble. So if we don't have any fat, like how are we going to absorb that, right? So there's these cofactors. So they work in
Mhm.
conjunction with one another. So of course, this is really important for like our overall mental health.
Yeah.
It also helps like regulate our hormones, right? Like nutrition in
Mhm.
general. We have to have good nutrition to regulate all of our hormones in our body. So, of course, that impacts our mood.
Mm.
Um, it can reduce inflammation. So, think about, you know, we, of course, we need inflammation in our body. It's a
Right.
natural immune response. It's good, right? Like
Mhm.
that's why we get like bruises and things like that. And that's actually a good immune response.
Mm.
But we want to make sure that like we're not dealing with chronic inflammation because
Okay.
chronic inflammation can really contribute to like mental health conditions, right? So that's that's not going to be supportive for us.
Right.
Um, of course, nutrition affects our gut health. So we've kind of touched on that, but our gut
Yeah.
health, that gut brain connection is so close. Even though in our bodies, like of course our brains up here and our guts way down here, but it's like they are like they work together so closely. They are like
Mm.
the best friends. And so
Yeah.
if we don't have our gut health, that can lead to some mental health struggles as well.
Mhm.
So, a little bit more about our gut. So, our gut has all this bacteria, right? Like
Yeah.
trillions of like all these tiny little bacteria, and we need this bacteria. This is like super important for our overall health. But
Mhm.
these bacteria produce neurotransmitters. So these are like little
Wow.
messengers that help carry messages around our body. And so let's take serotonin, for example.
Sure.
And serotonin, we all know, is like our mood, right?
Yeah.
It really impacts our mood. So, when our gut health is really poor, this can actually lead to inflammation that changes the production of these little neurotransmitters. So, this will lead to like
Wow.
depression, and can lead to anxiety, fatigue, being like not able to focus, which can be depressing for people because they're not
Yeah.
able to accomplish the things they want to accomplish. So it's just extremely important and extremely connected for sure.
Wow. Yeah, I mean, it's so interesting to me how much, more that, this kind of stuff is coming out, and it seems to be, more recently, in our culture, people are trying to start taking these holistic routes. And I recently, when you think about like the gut and the brain connection, I heard somebody kind of say it like, you think about you're about to go on stage and you're nervous, in your mind. Well, then you get butterflies in your stomach and your stomach kind of feels jittery. So it makes sense. I'm like, oh wow, okay. So like they like, kind of thinking about it in that way, like they really do connect, just even on in that like simple level that we see, in our everyday life. So um Rachel, what would you say, if somebody's listening and they, feel really low energy, they're not in the best place, they maybe are dealing with some of these chronic conditions, what would you recommend? What would be the first step they should take, whether that is reaching out to somebody like you or, finding some information? What does that look like?
Yeah. So, first, I want you to acknowledge your feelings, right? Those
Mhm.
feelings are really valid. Like, it's perfectly normal to feel happy, sad, overwhelmed, like whatever, like scared maybe.
Yeah.
um I think recognizing that those feelings are happening is really really important, so I definitely think that's the first step. But also, like, make sure you have an outlet for those, right? Try not to just bottle them up and like keep them inside, and
Okay.
that can be like journaling, or doing some self-care, talking
Mhm.
to someone about what's going on with you, whether that's a friend or someone that you met that's kind of dealing with the same thing. I
Yeah.
think can be really supportive. The second thing is like do a little research. I
Mhm.
think knowledge is power. So the more
Yeah.
you know, like the better you're gonna have a handle on it, right? Don't just take what the doctor tells you, which probably won't be a whole lot, and
Yeah.
walk out, right? Like go read read a book, get a book on it, listen to a podcast about what it is, from a doctor's perspective, even maybe, that will give you a little bit more like of a deeper dive of what's going on with you, because I think it will help you as you're dealing with this new, chronic condition.
Mhm.
Make sure you find your support system,
Yeah.
having people that understand you, right? That's that friend. That's that, a spouse. It can be someone that's dealing with the same thing. Again, that's going to be really great to have someone to kind of go through that with and deal with it. And
Mhm.
then I always like to recommend get a coach. I mean, this is the
Mhm.
person that's in your back pocket at all times. So, they're going to be there to support you, help you navigate, and learn about your condition. Find someone that
Mhm.
specializes in what you're dealing with. This person is going to be very passionate about what they're doing, is
Yeah.
going to be empathetic, but also
Mhm.
be the person to help push you forward as you go on your journey. So they're going to help collaborate and make a plan that's like specific for you, because
Mm.
again, I'm like big on that there's no one size fits all. Like people are like,
Right.
"Oh, I have this condition. What should I take?" And I'm like, well, I can't really guide you on like what to take, because I don't know, what's going on with you specifically, and what you have
Mm.
going on might be different than this person. And so,
Yeah.
I mean, of course, there's things that are generally supportive, but just
Yeah.
finding someone that can help you figure out what's going to be best specifically for you is going to be huge.
Yeah, all of those things are so important. Especially just like you were saying, realizing like it's okay to feel this way. It is very overwhelming. How can people get connected with you? And what are some of your specialties? Who are the kinds of people that you help? Share a little bit of that.
Yeah, sure. So you can find me on Instagram. I post there every day of the week. So, and this is for anybody really. This is general health and wellness tips that I like to post. So it's wealth.of.health.atx. You can also find me on Facebook. You can go to my business page or my personal. You can find me. It's Rachel Plymeyer. I'm right there on Facebook. You'll be able to locate me pretty quickly. You can also go to my website, which is wealthofhealthatx.com. Um, yeah, so I'll tell you just a little bit
Hmm.
about what I do.
Yes.
Um, so I work with a lot of people that have autoimmune conditions or chronic
Hmm.
conditions. Um, I work with a lot of people that have thyroid conditions as well, and primarily women. I do have a couple of male
Hmm.
clients right now. So again, there's no like one size fits all here.
Right.
I can collect a slew of data and be supportive in a lot of different ways. Um,
Sure.
so basically, I start with a 6 month package. I love to work with people for 6 months. I feel like that gets a
Mhm.
really good foundation and helps them move forward
Okay.
with what's going on with them. So we're going to work on things like sleep. Your nutrition, of course, is very
Hmm.
important, and stress, like how you're handling stress. Stress is huge, and we're not dealing with it the best. So trying to figure out ways to relieve stress, to deal with it that are healthy is really important. I
Okay.
do take a food and mood journal. So I'll ask you for just a
Mm.
few days to write down what you're eating and then how you're feeling. So
Wow.
it really gets people to tune in and get like with themselves, right? Check in with
Hmm.
yourself. And people don't take the time to do that, they ignore
Yeah.
it. And so we do that. I'll do a deep dive in your health history. And then, of
Hmm.
course, we're going to do a nutritional assessment questionnaire, which will give me tons of data to work off of to figure out what kind of things are lacking in your diet? Is it minerals?
Mm.
What are we looking at here? Is it your fatty acids? Do
Yeah.
we have some blood sugar regulation issues going on? So it's really, really fun to collect this data and to start there and to figure out how we're going to accomplish health goals that
Hmm.
are going to help you feel better and make your life easier.
Yes, which is the goal for sure. Living a healthy and happy life. I encourage everybody who is listening to contact Rachel. We will also link her website and social media accounts down below. Rachel, thank you so much for coming on the pilgrimage today and sharing all of your wisdom. I know that it will help many people.
Thank you so much for having me.